Cohen, Associate Professor in the Department of Surgery in the Division of Head and Neck Surgery and Communication Sciences within the Duke Voice Care Center, and I practice laryngology. Hours until all the sensation comes back in their larynx. But I usually do let them talk afterwards. I explain that the voice may be worse before it gets better because this is a temporizing measure, so I typically will over-inject with the collagen on purpose to get it to last as long as possible. So for him, his vocal cord closure was pretty poor, so voice therapy really was not an option for him. Because it was idiopathic and it was early in the onset, I would not proceed directly to a permanent laryngoplasty. So for him, I think the only other option was doing this in the operating room. Being on blood thinners and being a cardiac patient, there's risk with general anesthesia, so I think overall, from a morbidity standpoint, this is certainly safer for the patient. And certainly I would be amenable to having that done in the office versus having to be NPO after midnight, go to the operating room, and then have to recover from anesthetic. So I'm going to go, this is just some lidocaine, okay?
Yeah.
And we're going to inject in the cricothyroid space with the bevel pointed superiorly, so the medicine will go through the vocal cords and then kind of fall down and numb the area from the inside, okay? You're going to feel a pinch and then you will cough for a few seconds. Just hold really still and don't bump my arm. I draw back until I get air and then brace my left hand because he's going to cough and get that in as quickly as we can. And there's the cough. That's mixing the lidocaine around everywhere.
Yeah,
and then just a little bit more lidocaine I'm just going to do in the skin, okay? And I always do the other part first so I don't cause a huge bleb and then have a hard time getting the lidocaine endolaryngeal, because that's really where we need the lidocaine. Okay, and while that's working, I'm going to get everything mixed up, okay? And she's already sprayed your nose, and I just mix it up with injectable saline.
Do you have a certain amount that you use?
I do 1.7. Sometimes I try and cheat and do a tiny bit less. So about 1.6 sometimes, but if you make it too thick, it's hard to inject the Symetra through the needle, so you can't get rid of too much of the saline. And then, because this can clump sometimes, what I do is I've already pulled the syringe back from 2 to 3 mLs and banged it around a little bit. And then you want to get the air, get the saline up flush with this connector. And this is the most important part, is I have to get saline to the plunger so it doesn't clump. So I do it really fast and I keep the pressure on there. Now I've got plenty of saline down here, and then a few more little bangs to distribute that, and then back and forth quickly. And now we don't have any clumps. Now I just got to get the air out. So back and forth, and then let the air come back into the 3 cc syringe, and then you just do that a few times, and eventually all the air will come out. Okay, so now we have no more air, so we're ready to go. And then I take one of these 1.5 inch 23 gauge needles. And make sure that my Symetra will go through. So I'm getting it out the end, and because I like to go through the cricothyroid space, sometimes it's hard to go through the cartilage. I'm going to put a bend on this. Make sure it's still running. And then the angle we're going to try and do is go laterally through the cricothyroid space, and then we have to drop our hand down pretty quickly. And sometimes people with short necks, it's hard to get that angle to get superior enough, so I find that that bend helps a little bit. And then we're going to put the camera in the opposite nose. Since we're doing the right side, we'll try and go in the left nose to have a good view. And you're comfortable? Okay. Do you want something behind your head? Okay. Just breathe. We can see the blood from my injection. And we'll just take a quick picture before. And say E. Say E.
E.
Try and hold that one more time.
Can you swallow for me, sir? Excellent.
Good. And he.
E.
Trying to hold it. E. Okay. All right, so nice easy breathing now, okay? I'm gonna see if I can slide in here. Okay. So I'm getting closer, but I'm still too inferior. Almost there. And sir, hang tight. You're doing great. All right, so I'm right in the vocal cord now. Hold really still. There we go. Getting really fat, and we'll take a picture again and say E. One more time, hold it out, E. Okay, all done.